One of the more complicated ways of being able to help your tics is a method called habit reversal. The main way of being able to do this is you need to be able to locate the premonitory urges which happen in your tic. I like to call these the tic signals instead of premonitory urges because that sounds a bit too serious for me, but it's the feeling inside your body that lets you know your tic's coming. If you're ever able to hold your tics in and suppress them, then you must know that they're going to happen, so you're probably aware of those signals. Now, as we've discussed earlier, they feel like a tingle or a burning or a build-up of pressure in the area that you're about to tic. Some people, for example, who have eye tics describe a heavy feeling on their lids which makes them want to close, or on your nose it might be an itch on the side that makes you want to do that kind of movement. The trick is to think about your tic in minute detail and know what it does and how, so that you can put in the opposite movement to the tic. So for example, if your lip goes up and you make a rabbit pout like that, the opposite movement to that would be a lipstick roll, where you'd hold your lips together tightly and stop your body from being able to do the tic. Now, the goal of this is not to get rid of the urge, but to make you learn to live with it. The goal of the tic guard, as we call it, or the competing response, the opposite movement, is to stop you from being able to do the tic. Those urges last for about a minute and a half, but they make you feel awful, and you probably feel like you're going to explode or your head's going to come off if you don't do them. That's not what happens, but no one really rides them through unless they've tried this technique. So your tic feelings last for about a minute and a half. Once you get that signal, you put in the opposite movement and then you hold it so that your tic is not able to happen. Then you use deep breathing and thought distraction until that feeling's gone away. Practice it and see what happens for you. The goal of habit reversal is to make you habituate to the feeling of the tic urge. You won't get that relief, and the tic itself makes you feel kind of done and that you're complete. You won't get that, and for some people this is really uncomfortable and they don't like doing it. It also makes you focus on your tics, and for people, say, with ADHD, it can be really hard to concentrate on this and be able to remember to do it. So it's not for everyone. But if you feel like giving it a go, remember, figure out your urge, figure out what your tic does, put the opposite movement into the first part of your tic, and then try it. And try and catch it every time you feel that urge and get it into your practice to do it, into your daily routine, and you might find that you're able to catch them, and then after a while it gets a little bit easier. People have described to me that it takes a good couple of weeks to be able to learn this process, and for that 2 weeks they feel very sore and very annoyed. So please be aware of that and tell other people around you that you're going to be working on it, and you don't want people to point out to you, or you don't want people to ask you what you're doing, because it will remind you of it and make it worse for you. So have a go, and there's lots of literature on the internet and in books about habit reversal if you feel like reading a bit more.